Okay, so we want to talk about what are the physiological things that actually control whether we need blood to flow through to tissue or not. So one of the first things is called metabolic theory of autoregulation, which is a big, long phrase for basically if the tissue's active, it gets blood. So if the tissue's active, it's metabolically active, you're going through cellular respiration, you're using oxygen, the blood supply is going to increase to it. So that makes sense, right? So it's based on hydrogen ion buildup, but this is all I want you to know. Okay, there are some vasoactive chemicals that are going to trigger blood flow. So things like if you're in pain, things that are going to cause inflammation. Reactive hyperemia is if you get embarrassed and blood flows to that tissue. Okay, or you cut off the flow to tissue, like you're leaning on your arm and you fall asleep on it and you wake up and it's all tingly. Okay, so then blood is flowing back to that tissue. Angiogenesis is a really interesting concept. So angio is vessel. Okay, and genesis is like growth of or birth of, or like the beginning. So this is about the growth of new blood vessels. So if you have new tissue, or maybe they're interested in it and with cancer research. So if you have a tumor, they're trying to study what causes the blood vessels to actually go to that tumor, and they're trying to figure out what causes that to happen, because if you could control the blood supply, then you could stop the tumor from forming. Okay, but these are just 4 basic ideas of what makes blood flow to specific tissues. Okay, now for blood to get back to the heart, it's takes a couple extra things, because you don't have a pump at your feet or something to pump the blood back to your heart. So basically, we have to use our body parts to try to get the blood back. So the pressure gradient, so it's very, very low pressure in the veins. It does get a little bit higher as you get closer to the heart, but it's very, very low. The pressure's low, so it's like a lake. Okay, so in order to get blood back, one thing is gravity is going to drain the blood from the head and the neck back to the heart. The second thing is the skeletal muscle pump. So I'm going to go forward a slide. I hope this works. Well, I don't know if it'll work. Okay, skeletal muscle pump. So basically the idea is this. Okay, so here's the vessel. So this is the blood vessel, right? And it's a vein, so it's got a valve. And then this is muscle. And this is muscle. Okay, so the blood is going back to the heart through a vein. Okay, so pretend this is your leg muscle. Then what will happen is when you stand up, your leg muscles contract and squeeze this and force the blood back to the heart. So if you've ever been like in a concert where you've had to stand or sing, or you get married, or you're in the military and you're standing at attention for a long time, what happens is you're not contracting your muscles, so the blood pulls. You have venous pulling, and the blood will all pull towards your feet, and then you pass out because your brain doesn't have enough blood. But if you stand there and you kind of contract your muscles back and forth, it actually squeezes the blood back towards your brain. Okay, now, another thing is the thoracic pump. So the thoracic pump, so every time you breathe, you're changing the pressures in your thoracic cavity. And when you're doing that, that's forcing the blood back to the heart too. Okay, so when you inhale and exhale, it's squeezing the aorta and getting the blood back to your heart. And it also works when your heart contracts and relaxes. It brings blood back, it moves the blood through. So you just have a couple different ways to get the blood back. Another thing would be valves, right? The valves are important so that the blood doesn't flow back. Here's a picture of the skeletal muscle pump. Okay, so when your muscles are contracted, it's going to squeeze the blood towards the heart. But when your muscles are relaxed, it kind of pulls. So if you don't contract, you stand with your legs locked for a long time, the blood will pool and you can pass out. Okay, so there's skeletal muscle pump. Exercise helps venous return. Okay, so the more you move, the higher your cardiac output and the higher your blood pressure is. So that's going to also increase your skeletal muscle pump. It's going to increase your breathing. So it's going to make the blood circulate better. Okay, when you're just standing, you have venous pooling. If the blood all pools, what happens, your cardiac output could drop, and that causes you to be dizzy or to faint. And pilots wear pressure suits so that doesn't happen to them. Blood to pool in their leg. Okay, now disorder of veins is varicose veins. So basically, normal veins, okay, the valves close, okay, and they're going to force the blood one way. And someone that has varicose veins, what happens is the veins, the walls of the veins become weak and the valves become incompetent and they don't close. So then the blood pools and the veins stretch out. So this can be hereditary. Okay, some people are just born with it. Happens a lot in people that are on their feet all the time, like nurses and servers, people like that. Okay, now another problem is a DVT, so deep vein thrombosis. So a thrombosis is a blood clot where you don't want it. So this is a blood clot. And basically a DVT is if you're inactive, you might have surgery or maybe you have varicose veins. The blood isn't moving as consistently as it should be, and it'll clump up and you'll get a clot where you shouldn't have a clot. And usually it gets hot. It's like hyperemia. It gets hot, inflamed. You get into trouble when a piece of the clot breaks off and it travels, and that's when it becomes an embolus. So it's a traveling blood clot. And you don't want an embolism. Okay, now edema. Okay, so edema is fluid accumulation. That's supposed to say accumulate. That doesn't look like it. Accumulation in tissue. Okay, so edema could occur anywhere. It can occur in your fingers, in your toes. It can occur in your abdomen. It could occur in your head, in your brain. Okay, so edema is when you might not have equal, your heart might not be working right, or it could be something wrong with your blood and with your capillaries. Okay, so what can cause it? So one thing that can cause it is capillary filtration. Okay, so if you don't have very good venous return, so if you're stuck, if you're sitting, you're not moving, then the blood's not going to get back to your heart and it's going to pull in the tissue. Congestive heart failure, so if the two sides of your heart aren't working equally, then fluid could accumulate in the lungs. If you're not moving, it could cause a problem. Okay, if you're in kidney failure, you're retaining water, your capillaries aren't filtering out water, and that can lead to high blood pressure and edema. Histamine, so like allergic reaction to something. So when histamine is released, capillaries become more leaky or permeable, and fluid can accumulate. Sometimes the capillaries aren't reabsorbing fluid. That can occur if someone doesn't have enough protein in their body. So I have hyperproteinemia, so that would be decreased protein. Okay, so maybe they have liver disease, so cirrhosis, and their liver's not making enough albumin. Famine, there's not enough protein in their diet. People who are burned have low protein, and sometimes people with kidney disease. Okay, another thing that could cause edema is if the lymph nodes are blocked. So the lymph nodes, or the lymph vessels actually flow alongside the regular vessels, and they pick up extra fluid. And if they can't pick up the fluid, then sometimes that leads to edema. Consequences of edema, it could lead to shock. So what happens is the fluid could actually reduce the blood volume so much that your blood pressure goes down and you could go into circulatory shock. So that's a problem. Another thing that can happen is because there's so much fluid, it's hard to get oxygen to the tissue, and it's hard to get the waste removed, and the tissue can die. Pulmonary edema, that could lead to suffocation. You have too much fluid in your lungs. And cerebral edema could lead to headaches, nausea, seizures, and it could lead to coma and death. Right. That's my happy story, huh? Okay, now circulatory shock. So shock is basically any state where the cardiac output doesn't meet your metabolic needs. Okay, so it could happen if you're having a heart attack. Okay, it could also happen if you're not getting enough blood back to your heart. So you might not get enough blood back to your heart if you don't have enough blood. Okay, so if you're bleeding, you're hemorrhaging, okay, that leads to hypovolemic shock. If you have a tumor blocking a vein, you might not be able to get fluid back. Okay, or venous pooling. Okay, so venous pooling was the standing too long. Okay, now neurogenic shock is if you have brain damage. Okay, so if your medulla oblongata is damaged, you lose control over the size of your blood vessels, and everything dilates, and that'll cause neurogenic shock. This is also the shock when somebody gives you bad news and you pass out. Something like misfires and your blood vessels dilate and you faint. Okay, now septic shock. Septic shock is when you have toxins from bacteria. So the bacteria are growing in your bloodstream, multiplying in your bloodstream, and the toxins cause vasodilation. So then your blood pressure drops. Okay, capillary permeability drops. So your blood pressure drops, and you could die. Okay, now anaphylactic shock is when you have a very bad immune reaction. So you have some sort of allergic reaction, and you produce an excess of histamine. Okay, histamine makes capillaries super permeable. So the fluid leaks out of them, causes vasodilation, the blood vessels get bigger, and blood pressure drops, and your air passageway actually can close off, and you can die. Okay, now this can be reversed with epinephrine. Okay, so epinephrine is a vasoconstrictor. Okay, and that's going to increase your blood pressure. Okay, now if you go into shock, there's two reactions that occur. One is compensated and one is decompensated. Compensated shock is when your body is able to recover from it. So it uses some homeostatic mechanisms to recover. We're going to talk about this here in the next set of notes. But an example of compensated shock would be if you faint. Okay, so if you're not getting enough blood to your brain and you faint, so you go flat then, right? So it's much easier for blood to get to your brain, okay, and for you to wake up than it would have been if you were sitting up. So that's a form of compensation. Okay, decompensated shock is if nothing is working right. Okay, so your homeostatic mechanisms won't work. If that happens, you could actually have life-threatening positive feedback. So what happens is cardiac output goes down, heart muscle dies, cardiac output goes down, heart muscle dies, brain dies, cardiac output goes down, and so on. It just keeps getting worse and worse until death, which that's a lovely note to end on.